Well, with the economy in trouble, people are trying to save money any way they can, right? And most folks understand how you can get a better deal on a new car or a flat screen TV maybe, but you may not realize that you can also bargain down your medical bills. You just need to know what to ask.
What's that? That's a little bow.
When Fatima Medicarini was pregnant with her second child, she wanted to ensure a smooth delivery, but Fatima took her motherly duties a step further.
My experience with the pregnancy is educating myself to all the costs involved in having a baby, and then from that point on, tackling them one by one to see what kind of discount and savings that I could get from them.
That's right, Fatima went on a haggling hunt for the birthplace of her baby.
My overall savings, I would say probably between $4,500 to $5,000, probably about like 40% savings.
It's the medical business's dirty little secret. Doctor and hospital bills are often negotiable on everything from cosmetic dentistry to mental therapy and even plastic surgery. Patients have been able to save money.
No one knows for certain how often this is happening, but what we do know is that people that are trying to do this are having success.
According to one recent study, 66% of patients who tried to negotiate costs with their doctor were successful, while 70% of patients haggling with hospitals were able to get a better deal. While not everything is negotiable, doctors and hospitals do have more wiggle room than many patients realize.
Bargaining with a doctor is not as simple as just going on a used car lot and trying to get a better deal. Many doctors cannot waive an insurance copay, and that's because they have a contract with your insurer. So look for things that your insurer is not going to cover and try to get a better deal there.
You want to sit here for a little bit?
For Fatima, that means not being afraid to sound cheap.
My personal philosophy is always just ask. Be upfront with your doctor and say, how much is this going to cost me? And also ask the doctor what other costs are going to be involved, and then proceed with negotiating.
Okay. And joining me now is author and consumer advocate Ron Burley. Good morning.
Good morning, Kate.
So we were just talking about this in the break. It sounds sort of inherently wrong to be bargaining for medical care because you think the more expensive, the better the doctor.
Well, and that's really a myth. I mean, most of us don't mind paying our fair share for medical care. We just don't want it to cost an arm and a leg.
Right.
So,
literally.
But what you don't want to do is be negotiating on the way to the operating room. You want to do all of this in advance.
But it's okay to negotiate. It's not that the more expensive is the better doctor. You can get good medical care for a cheaper price. Okay, so what do you do as far as your own physician's office if you want to bargain with your doctor you already have?
Well, one of the things is to be very flexible as far as your schedule. If you can take that early morning appointment that nobody else wants, or maybe be ready for a cancellation, you can get a discount. Doctors work by appointment, and if nobody is there for the appointment, they're not going to get paid. They'd rather take 75 cents on the dollar rather than nothing at all.
Oh, that's a good point. And elective procedures, you say that flexibility is key there too?
Well, yes. If you're having an elective procedure and you're in town and you can arrive on short notice, if they have a cancellation, they may want to group those procedures into a day. One of them drops out. They've got all the equipment out. If you can slide in there, you can get a big discount. But you do want to arrange for it in advance.
Yeah. Don't be negotiating on the way to the operating room. Not just the doctor's bills, also the bills for the lab work can really be killer. Those can be high priced.
Yeah, this is really important because when you go in for any medical procedure, a physical or whatever, there's always lab work associated with it. And this kind of works like the fast food restaurant where the soda is where they make the profit, not the burger. Well, very often the clinic is associated with a hospital or clinic, and that's where they make their money. But in any town